optimize the male. So to try to identify everything and anything that is compromising his
man should be tested for or evaluated for fertility. What does that even involve, and when?
No,
and
partner should be evaluated simultaneously.
Okay.
And what it involves is a visit, thorough history and physical, to try to determine, are you having sex enough? I have patients, or they're using lubricants, simple things, I've spoken several times now.
How much is enough?
Show. Right, most invasive. So if I can get you pregnant the old-fashioned way, it's a lot cheaper,
sure,
and then theoretically more fun.
Exactly.
There's only a certain window in the woman's cycle that you can actually establish a pregnancy. So it's 6 days before she drops the eggs. We'll do these stick tests where they buy them and they have little happy faces and says, okay, you're supposed to have intercourse right now.
Mm-hmm.
One way to really get those tests, though, is that these tests rely on a hormone that is secreted. But that is only going to tell you 24 hours before she drops the egg.
Mm.
So if you start then, and it is the most, successful time, but you're doing a lot of practicing afterwards.
Okay.
My goal is, my job is to educate and to make sure that people are doing it correctly. And because what happens is this sometimes that, the only time they'll have intercourse now in the month is when it's supposed to be, the fertile window.
Uh-huh.
And so the rest of the time, couple issues, relationship issues, erectile dysfunction in men actually happens.
No pressure.
Because anxiety is too much.
Yeah.
And it becomes a real issue. And again, if I want to get you pregnant the old-fashioned way, we got to have sex.
And are there any? You said, I believe, that it was your job to make sure they were doing it correctly.
Right.
Do you have any tips?
I stand on my head, or if she stands on her head, or there is no magic way to have intercourse. It is just have it more. That showed that patients that had or couples that had the intercourse within that 6-day window had a higher the every other day, just so that it's not stressful. I would have it as much as you can
on the hour.
during that. During that, you have to ask, because a lot of the stress and the jobness of doing this intercourse makes well. So no lubricants, because I've done some tests on lubricants in the lab, and there is no safe lubricant. Even if it says clump around the substance, it doesn't necessarily kill the sperm, but it immobilizes it.
Okay. Previously, we talked about erectile dysfunction and how there are some really basic things and habits and so forth and risk factors that make men much more likely that are linked to male infertility. So could we chat about those things? Like, what are some things that that are totally...
Right. Just as you alluded to, male infertility or fertility is a marker of good health, just like erectile dysfunction. Same thing. So just like in erectile dysfunction, I think of the 4 pillars of good health: good eating, regular exercise. The stress is this performance anxiety. You hear time and time again people that spend thousands of dollars doing multiple cycles of in vitro fertility.
Yeah.
And part of it is sort of they've let it go, and now the stress is gone.
Mm-hmm.
And things happen, hormone changes. It's hard to study that because people respond to stress so differently.
Mm-hmm.
But anything you can do to reduce stress, we don't know the reason.
Mm-hmm.
Everything seems to check out fine. And part of it is addressing the couple, analyzing the relationship.
Tobacco, alcohol, and other drugs having an impact on fertility. Can you talk about that?
So alcohol, drugs, marijuana, that production is less or compromised. One of the big messages I want to leave you is young men, even young men, think testosterone is a little low. Oh, you're right, I feel a little tired. Well, who isn't tired?
Yeah.
They get prescribed testosterone.
Uh-huh.
Testosterone is a contraceptive. So
Really?
if somebody, and I get patients that come in and say, oh, I have no sperm, and come to find out they were placeholders who take anabolic steroids.
Oh, sure.
So, again, it's known in the subculture that their muscles get really big, but their testicles are infertile.
Uh-huh.
But it's, part of it is they do it anyway because of the, the culture, but by testosterone.
Okay. Now, if you are in a couple, if a woman's in a couple and they or drinks a lot or what have you, is that something to bring up? I mean, how would you recommend bringing that up?
I would definitely bring it up. It's that compromised sperm function. How much does it affect you? How much drinking is enough, or is this okay? You know, I have people that smoke and get lung cancer. So my point is, you know, one drink might affect one individual a lot differently than another. One, due to cut down or decrease those toxins, would be advised.
Okay.
Now, one of the things you have to realize is things in male infertility, your sperm count might not be affected for 3 months.
Oh.
And that's because men have a cycle. I always ask the women, do they get moody? It's a sperm cycle from the day an immature germ cell matures into the testicle and gets released into the wild. It may take, including any kind of effects with
That's still faster than I expected, you know.
Right.
Especially if somebody's been smoking for a long time.
Right.
Couples, you know, and isn't it a little more difficult to do something? I mean, so much of the medicine that's addressed it for things. So what kind of things do you do for men?
Right. So for men, one of the most common things is a varicocele. A varicocele is in the back of your legs. You can have them in the scrotum. And actually, it's very common in the general population. 15% of men in the general population office and can't establish a pregnancy with the partner happen to have a varicocele. So we think these varicose veins hurt sperm production by warming boxers versus briefs, you know, thing. You can wear whatever you want, but there has been
no heat pack down there.
Yeah, but there's a rise in the testicle if you have varicocele. So one of the most common procedures I do is a microsurgical varicocele repair. And it's a very outpatient procedure where I tie off the veins under the microscope so that it doesn't pool around the testicles anymore. And so the success rate is a 40% pregnancy rate. So it's one of the most common male correctable forms of infertility.
Help with this condition?
Well, one of the things is just going down to basics, meaning, you know, assess if the erections are okay and or just urgency, frequency. These kind of symptoms can affect your erections that can eventually affect your fertility. Spring from these conditions.
How do you know if your erection's okay? Or
well, if it's not firm enough for intercourse, or if it's going, so you know we're here to guide you. Yeah.
Good. Okay, that's good answer.
Problems urinary-wise or male infertility, you can always call the Incontinence Institute at 1-800-771-9. Or call me directly at the Center for Sexual Health, 314-315-9965.
Great. Well, we've been speaking with Incontinence Institute. Any final thoughts on male fertility and infertility?
Just remember that don't forget to evaluate the lost male.
Yes. Yeah. Okay. Well, good tips, very enlightening information. Thank you so much, Dr. Naughton.
Take care. Thank you so much for having me.
Yeah. So, John, what did you learn?
I would advise not asking me about that. 12. And I'll give you one quote, one takeaway from that conversation. She talked about releasing sperm into the wild, for one. I mean... That's
why we led the interview.
Right. Great stuff. I mean, I learned a thing or two. And my girlfriend definitely does not. Yeah. And, she's considering going back to school to get her PhD. So... know that
down
it won't. We know that it won't for several years.
Yeah.
So that's kind of...
Had you ever heard that about the link between fertility?
There's a lot of problems that are caused by smoking. I mean, let's be honest. I mean, there's a laundry list of problems that are caused by smoking. Right now, I'm not trying to have kids. Shoot, I might smoke more.
He's at the stage where you're trying not to, and then all of a sudden you get, and that's what happens to a lot of people. Yeah. Not that they'll happen.
And she made a really good point that you spend so long trying not to have kids. Yeah. Trying to have kids is the first time that himself and his wife were trying to have a baby. And he said, my entire life I've been trying not to. Yeah. And now I'm trying to.
Well, good topic. I think that was very interesting information. I definitely did not know a lot of that stuff, so good to know. We're going to go ahead and take a break. Stay tuned to 1380 AM and 1380thewoman.com.